Sardines are often promoted as one of the healthiest fish choices because they are small, oily, and naturally rich in nutrients that support heart, bone, and metabolic health. They provide high-quality protein along with substantial amounts of omega-3 fatty acids, vitamin D, calcium, when eaten with the bones, selenium, and several B vitamins. From a general nutrition perspective, sardines can be an excellent food. However, for people with gout or chronically elevated uric acid, sardines present a clear and well-documented risk, and their reputation as a superfood can be misleading in this specific context. The main problem lies in their high purine content. Sardines, like other small oily fish, contain a dense concentration of purines per unit of weight. When these purines are broken down during digestion and metabolism, they are converted into uric acid. In individuals with normal uric acid handling, this increase may be modest and temporary. In gout-prone individuals, whose kidneys may already struggle to excrete uric acid efficiently, the same intake can cause a significant rise in blood urate levels. This rise increases the likelihood of uric acid crystallization in joints, which triggers the intense pain, swelling, and inflammation characteristic of gout attacks. What makes sardines especially problematic is how easily they can be overconsumed. They're often eaten straight from the can, added to salads, pasta, toast, or rice dishes, or incorporated into sauces. A single can may appear like a reasonable portion, but it can deliver a purine load comparable to much larger servings of lower-risk protein foods. Because sardines are frequently canned in oil or brine, the purines remain intact, and cooking or processing does not meaningfully reduce their gout-triggering potential. Repeated exposure, even if individual servings seem modest, can contribute to chronically elevated uric acid over time. Another important factor is frequency. Even when sardines are eaten in small portions, regular consumption can steadily raise baseline uric acid levels in susceptible individuals. Many people with gout assume that replacing red meat with sardines is a safer or more anti-inflammatory choice. While sardines do contain omega-3 fats that support cardiovascular health, these fats do not counteract the uric acid increase caused by purines. As a result, people may unknowingly worsen gout control while believing they are making a healthier decision. Sardines are also commonly consumed alongside other dietary factors that worsen gout risk. Alcohol, particularly beer and wine, is a frequent companion to sardine-based meals and independently raises uric acid while reducing its excretion by the kidneys. High-salt preparations can encourage dehydration if fluid intake is inadequate, further impairing uric acid clearance. When these factors combine, the likelihood of a gout flare increases substantially. For individuals already experiencing a gout flare or recovering from one, sardines are particularly risky. During these periods, the body is in a heightened inflammatory state and tolerance for purine-rich foods is lower. Consuming sardines at this time can prolong symptoms or trigger additional attacks, making recovery more difficult and increasing cumulative joint damage. From a practical standpoint, sardines should be treated as a rare food rather than a regular protein source for anyone with gout or high uric acid. If they are consumed at all, portions should be small, frequency low, and they should be avoided entirely during flares. Careful attention to hydration and overall dietary pattern is essential, but even these measures cannot fully offset the purine load sardines provide. The nutrients found in sardines can be obtained from safer alternatives. Omega-3 fatty acids can come from fish that are lower in purines when eaten in moderate amounts, or from plant sources such as flaxseed, chia seeds, walnuts, and algae-based supplements. Vitamin D and calcium can be supplied through low-fat dairy, fortified foods, eggs, and appropriate supplementation if needed. These options allow people with gout to meet nutritional needs without repeatedly challenging their uric acid balance. In summary, sardines are highly nutritious, but pose a significant risk for people with gout or elevated uric acid due to their high purine content, ease of overconsumption, and frequent pairing with other gout-promoting factors. For gout-prone individuals, Enjoying sardines rarely and in very small portions, or avoiding them altogether, is a more cautious and joint protective strategy than relying on their nutritional reputation alone.